Hello, everyone. I wanted to do a prelude or prelude, I don't know if I'm saying that right, to this episode of estrogen dominance. And basically, I want to do this because there's a lot of talk about hormones and how things break down. And I do the best that I can to summarize things in order for it to be more digestible. But I thought explaining it a little bit more here would help prepare you for the episode so you can start to understand and take away things a little bit easier. So basically, we're going to explain why painful periods are not normal, tender breast, mood swings, PMS symptoms, you name it, how we've normalized them in society. And we're going to go through the menstrual cycle and the different phases and how hormones are affected during that time. We have 4 main hormones during our cycle. And the 2 that I want you to focus on is going to be progesterone and estrogen. So we'll be talking about LH and FSH, but just for now, during this episode, to break things down to be more digestible, just focus on the progesterone to estrogen ratio. So there's going to be, the ratio is important because when we have low progesterone, that's when we get a cascade of all of these symptoms that you'll soon find out. And the biggest takeaway from this episode, you're going to get a lot of information on where to start and what to do. And I summarize this in the end of where to start, but one of the most common reasons we have low progesterone is due to chronic stress. And we live in a society that really capitalizes on us being stressed, living in fear, and constantly running around with their head cut off. So I didn't say this in the episode, so I wanted to say it now, is that I think it's important for you to listen, after you listen to this episode, if you haven't listened to episode 2 of season 2, I would highly recommend it. I talk about anxiety and stress and how it shows up and different ways we can look at it and how it shows up in our body and different ways to approach it that may be non-conventional, but also conventional as well. Another thing that we'll talk about in the episode as well is something called insulin resistance. And we dive more into that about how that's a big reason why we have chronic weight gain, maybe around the midsection, ongoing high blood sugar, how that can set off a whole cascade of other symptoms as well. What I don't mention in this episode, which I wanted to, but I just didn't cross my mind, and because we were trying to get it done in an hour because she had a prior engagement, is something called a continuous glucose monitor. So this is something that's been incredibly helpful for me to understand my insulin resistance and how that affects a variety of symptoms such as endometriosis and all these things. So that's something that I would love to add in there, is that you can work with a dietitian or a nutritionist that understands the blood glucose monitors. They're continuous ones, the ones that you put in your arm. And it's really incredible how much information you can get out of that, because you may be surprised on what things spike your blood sugar. Like for me, my inhaler was spiking my blood sugar. And if I had more than 1 cup of coffee at a time, it was spiking it through the roof. So this was also worsening my period symptoms as well. If this doesn't make sense, bear with me, listen to the episode and you'll see how they all tie together. But basically, when your insulin isn't working, we have more glucose in our bloodstream. And when that happens, we can develop more fat. And then when we produce more fat, that produces more estrogen, thus adding to the estrogen dominance issue. And at the beginning of the episode, Michelle talks about how it's the ratio of things. We want more of that progesterone in that end phase of our cycle, which is called the luteal phase. So you may need to listen to it a couple times. This is a very important episode because it can be really impactful. And then finally at the end, she suggests different ways to help lower the estrogen. And the common denominator of all that is going to be managing chronic stress. And then you can kind of add on a lot of these other factors. I wanted to do this prelude because I know it can be incredibly overwhelming. I've been on the other side of this. I have tried to do everything perfect immediately and then went to a shame spiral because I couldn't do it. And so I just want you to start being aware of these things. Just don't even need to change anything right now. Just start bringing it to your conscious level to understand. And then after this episode, if you haven't listened, listen to episode 2 of season 2 on anxiety. And I think you'll get a ton of great information about this. I know that it's been really impactful on my life and gaining control over my cycle and my pelvic pain. Now, further ado, we will jump into the episode.
Ready to tackle the topics that you've been curious about but never felt comfortable asking? With a straightforward, no-nonsense perspective on life, blended with candid stories and a healthy dose of humor, Dr. Mary Grimberg cuts through the fluff and addresses the conversations we all need to have on TMI Talk, where no subject is too taboo. Our bodies, our minds, and everything in between. Now here's your host, Dr. Mary.
Hello, everyone, and welcome back to TMI Talk with Dr. Mary. Today in this episode, we're going to dive deep in with Dr. Michelle Weeks on painful periods, fibroids, mood swings, endometriosis, infertility, irregular periods, and weight gain, especially around the midsection. Oftentimes, this is due to something called estrogen dominance. And so that's what we're going to dive into today. And as Dr. Michelle talks, we will break down a lot of these really complicated terminologies and hormones to make it more digestible for you to understand. So before we move further, I would love to introduce Dr. Michelle Weeks. She's the founder of Weeks Wellness. She has gone through the CAP pelvic program through the American Physical Therapy Association, a board certified women's health clinical specialist, one about 500 in the country. Dr. Weeks has also received her certification in dry needling. She's also received a functional fertility certification through A4M and training in next level functional nutrition. She has also obtained advanced training in the areas of visceral and neural manipulation through the Barrel Institute. She also has a Mercier therapy certification for fertility and myofascial release. Woo! You are just pretty awesome. And if for those of you that don't know Michelle, she's also a friend, a colleague, and a mentor for me. So I am really excited to have you on here, and you're so humble.
I am so excited to be here because I love talking with you and just sharing all this information with
you have
everybody.
Such a wealth of knowledge that I'm like, the world needs to hear what you have to say. And how many clinics do you have now?
I have 4 now.
That's awesome.
Yeah. So just opened our 4th in Littleton, Colorado.
Awesome. Where can you tell everybody where your other locations are?
Yeah, absolutely. So I have my main clinic in Tallahassee, Florida, and then we have one in Cambridge, Massachusetts, one in Arlington, Massachusetts, and now one in Littleton, Colorado.
I don't know how you do it all. For you all listening, she does everything, I swear. We met way back like a couple years ago at the pessary training and hit it off.
That was so great. Like, meeting you was like the greatest like part of that training, honestly.
Yeah, same. Yeah, we just immediately hit it off. So I'm excited to share this with everybody. So, hormones are incredibly just, I believe, misunderstood, not talked about. And I'm somebody that has struggled with estrogen dominance, and you helped me with this. And once I've learned this, my mind has just been blown. And so can you break down what estrogen dominance is so people can understand from just kind of a basic level?
Yeah, absolutely. And I'll probably take a little bit of a step back from that too, and just tell people, so hormones are actually the way our body sends messages to itself. And so it's this very delicate kind of dance imbalance. And so if we have too many messengers, it should trigger our body to stop producing some things. Or if we don't have enough messengers giving the message. It should tell our body, okay, we need to kind of build this back up and produce a little bit more to make sure that we just have this really nice balance in our system. And then I think a lot of people think balance means even, right?
Mm-hmm.
But that's not always the case, especially with hormones. Some things we want to be, we want a higher ratio of one to another, and that's actual proper balance. So it's not always they should equal each other. And I think that sometimes brings a little bit of confusion for people too when they think about like, oh, I have to balance my hormones. What does that truly kind of mean to them? So essentially, estrogen dominance. Now, there are times if you're a cycling female that you actually want to have more estrogen in your system than progesterone. So that's what we're going to kind of talk a little bit too about ratios between. So really the first half of your cycle, so the day that you start bleeding is cycle day 1 up until the day that you ovulate, that's something called your follicular phase. And it's within that phase that you actually do want more estrogen circulating in your system. And then after you ovulate, so after ovulation, but before you start bleeding again, that's your luteal phase. And in that phase, you want your estrogen levels to drop and you really want your progesterone to be at a higher level. And so depending on what phase you are in your cycle, that's going to mean something a little bit different for your estrogen. So when we talk about estrogen dominance too, what that means is we have too much estrogen when we shouldn't have it, and likely and or not enough progesterone, and that's the ratio that is off. And that can lead to so many different symptoms.
Yeah. And so when you say the ratio is off, can you explain to them when that ratio is off and how would somebody know? Because I know, I mean, it's the wild, wild west out here, at least in Austin, where people are just being tested for hormones. And they're like, oh, you're great. Everything looks good. Can you explain, like, if somebody's, maybe let's be real, people are going to have to ask their primary cares specifically for day, 3 or
Yep.
day 21. So can we kind of, what are some guidelines you'll give people?
Yeah, absolutely. So, because I just explained, so certain periods we would expect more estrogen to be in our system, and other periods or points during our cycle, we would expect our estrogen to be lower and our progesterone to be elevated. So, if we are testing our hormones on the wrong day in our cycle, then we will potentially not get any usable information. And I see this so much
All the time.
all the time.
All the
Yes,
time.
all the time, pretty much all of the time. So really, we want to test our estrogen levels, something called our LH, which is luteinizing hormone, and FSH, which is follicle stimulating hormone. And we're probably not going to get into those things too much today. But those we want to have tested on cycle day 3, potentially cycle day 4, because that's really when we're expecting and when research has backed up showing what our estrogen, our FSH, or our LH levels should be at that phase in our cycle. This is not when we want to test progesterone, because if we did, it's going to be low, but it should be low. So that's not an abnormal finding. We want to test progesterone when we expect it to be high, and that's going to be in the middle of that luteal phase, which they're estimating is around day 21. So generally, I tell people that it's really 6 to 9 days post ovulation. And they are just assuming that everybody has a 28-day cycle, which is also not necessarily the norm. But if you're not somebody that's tracking your ovulation and your fertility, then day 21 can be a pretty fair assumption. Or you could kind of do some math if you have a fairly regular cycle and let's say it's always 26 days, then you should know you could kind of bump that timeline up. So then you're probably going to want to test your progesterone on like, let's say day 18. And then once we have those numbers, so estrogen on day 3, progesterone around day 21, now we want to compare what those ratios are. And it should be about a 2-to-1 ratio of estrogen to progesterone.
So what if somebody though, like so many people have irregular periods. And so how would they how would they go about this? Number one, and number two, what about people on birth control?
Yes.
Two big questions.
That's a great question. So then sometimes serum blood tests are not the way to go. I like to also utilize something called the Dutch test. So it's dried urine assessment. So really what it's looking at is our hormone level, but also how our body is metabolizing our hormones, and then also looking at some of the precursors and really kind of the larger picture. So oftentimes that's my preference, and I will correlate them too with like the blood levels that we're seeing from more traditional labs, just to make sure that everything is kind of making sense. So when we're doing the dried urine test, and if you have irregular cycles and or you're on birth control, we have a little bit more leeway when we're doing that in our cycle. Generally, we want to aim for around that day 21 or post ovulation, which we know you're not ovulating, generally speaking, if you're on birth control, but in that time frame.
So roughly around day 21 or so. Okay. No, that makes sense. I mean, I've also seen it too, and you and I have talked about how you said, you had just said it's the estrogen to progesterone ratio is a 2-to-1. You had also mentioned before like a 100-to-1 ratio or a 200-to-1 ratio.
Yes. So you can also, depending on when you're testing, you could look at that too. So there are a couple. So you could, you know, test your estrogen with your progesterone on day 21, and we could look at that ratio a little bit as well, because we would expect to see estrogen to be kind of on that lower end. It's not going to be as helpful as doing a cycle day 3 and a cycle day 21, but we could definitely kind of look at different things. And then we're also, again, going to look at, FSH and LH. So really, I guess we will get into this a little bit.
I mean, I guess it's hard not to.
It's hard not to. So luteinizing hormone is, and some people that are listening, especially if they've been tracking their fertility or kind of have been in that space, oftentimes when we're looking at like ovulation testing and ovulation strips, that is actually looking to see if your LH has surged. And that happens just prior to ovulation and is what helps to trigger it. But in order to get LH to surge, estrogen also is surging at the same time. So they kind of correlate closely together. So that's another kind of way we can help look at that. So we want to see, does our estrogen level kind of make sense with what our LH level is on those serum blood tests too, just to kind of give us a more well-rounded picture with that.
So like if somebody's looking at, like if you pull up and you guys, if you're listening, you can kind of pull up a hormone level chart based on like your cycle, right? So when you're looking at it, you see like a little bump around day 3 for estrogen. So why is it that it's day 3 for that? And then like you said day 18 for the progesterone?
Mm-hmm.
So what about those days? I just think it's important, like when people understand the why, because then it just kind of clicks more. At least for me, that's the way my brain works, right?
Yeah, absolutely. So estrogen is helping to build our lining of our uterus up. And so that's why if we've shed our lining and we're menstruating, then we're going to see that estrogen kind of start to come up in order to prepare for our next cycle. And so during that follicular phase, so the reason it's called the follicular phase is because our ovaries are developing follicles to determine which egg potentially we're going to ovulate. And so during that phase, we have FSH, so follicle stimulating hormone, is being produced because we have all these like little like baby, can I call them baby eggs? I don't know if that makes sense. Little baby eggs, and we want to see which one is going to mature into the biggest, potentially best egg. And that's what our body is going to choose to ovulate. Okay. And so we want estrogen to come in, and it's going to help to prepare our uterine lining during that phase as well. And so we've got these follicles that are growing. We eventually end up with one winner egg follicle, and then our LH and our estrogen surge, boom, we ovulate if everything is functioning correctly. And then what happens is that that follicle that we ovulated, that starts to produce progesterone. And so now we see estrogen is coming down, and this ovulated egg is producing this progesterone because that is potentially what's going to allow it to survive and turn into a baby if a sperm comes in and fertilizes it and we go forth. And so that's why really in that second half, in that luteal phase, we do want to see progesterone coming up. That's a really good indicator that you actually ovulated that cycle. And so sometimes what happens is if we're not ovulating, then we're not going to see that spike in progesterone. Or potentially if that egg quality is not great, our progesterone might spike a little bit, but not really to the level that we would want it to if we're thinking about it from like a fertility aspect. So there's just some different numbers that we look at, and definitely more of an optimal range of numbers as well. So where, maybe your physician looked at your lab work and you're within range. Well, we know that's a wide range, and that's not actually truly what's most optimal. It's like you took statistics, right? I don't know. You could help me break this down. There's like two standard deviations. So essentially it's like
I don't know what that means.
95% of the population fits in with the reference range. Like, would you say 95% of our population is healthy?
No.
But they're part of our reference range of what's normal. So it would be like saying, okay, so like most women wear size what, 5.5 shoe to 10.5 shoe. So that would be like what is considered normal. So if you wore a size 10.5 and someone said, oh, here's a 5.5 shoe, it should fit you because you're within this normal range. Is that going to be like comfortable?
Now I understand.
Are you going to be able to wear it?
Now I understand statistics. That makes much more. I don't know what standard deviation. I mean, I have tried so hard to understand that.
I hated statistics.
But I loved that example. I think people really like it. So let's go into what those symptoms look like. So at the beginning of the episode, we talked about, a variety of different symptoms. And so can you explain, estrogen dominance, oh my gosh, it can be so many symptoms. So let's go through what those common symptoms are and then the why. Actually, before we do that, try not to be overwhelmed with all of the hormone information. All I want you to focus on right now during this podcast episode is would you say the luteal phase, like the last half?
Yeah, the last half of our cycle is really where if you have estrogen dominance, that's when we don't want estrogen to be dominant. Yeah, yes. Exactly. So that's kind of where a lot of issues kind of stem.
Perfect. Okay. So typically after day 14. So if you tend to have more of these symptoms around day 14, let's just start paying attention to that. Your estrogen is going to be higher than your progesterone is going to be higher than your estrogen around that time. So that's the only thing you need to remember for this right now. So, okay, go ahead.
Yeah. So some classic symptoms that you have excess estrogen. So we're going to call that estrogen dominance. Weight gain. Okay, especially around the middle, and we'll kind of get into the why behind some of that in a second as well. Fluid retention, but really more specifically around your cycle. So I would even narrow this window down a little bit more and say probably about starting a week prior to when your cycle should start. That's when that fluid retention is something that you're going to notice. And then at the same time, too, if you notice breast pain or tenderness, which I know is so common. Personally, that's what I had for a while too. Like always, like the week before my cycle, like I'd be like, oh yeah, oh that's sore. I don't want to, go and do a lot of running or any contact sports or anything like that. No
jumping
jumping.
while the titties are flapping in the
Right,
face.
and they're sore.
Mine aren't big enough to flap in my face, but you don't want them flapping around.
Right. Not comfortable. And then any heavy bleeding during your cycle. And I'm going to pause on this for a second because I feel like so many people have no idea what a normal amount of blood loss is for their cycle. And I know every time I explain this to a patient, like I feel like their mind like blows because they just never would have thought that they actually had heavy blood loss when they did.
We've normalized all of these things in the media, on TV, on just the way we talk about stuff, and just the mood swings too. When I see them on TV, I'm like, shut up. Like they're like, oh, I'm on my period. Let me eat a bunch of chocolate and like be like in a bad mood to everybody. And that's just me. And it's like, if you actually calculate, if we just accepted this as fact, which we tend to have as society, okay? So if the typical person menstruates, we'll say 5 days, and maybe they start menstruating around, we'll say, I don't know, 12, and then maybe they go into menopause 55, like 50, we'll just say 55, just to kind of make this more dramatic.
Yeah, how many cycles is that, Mary? You doing math?
I am doing math. So 43 years times 12 times 5. Okay. That's 20, almost 2,600 days.
So what does that equal for years?
7 fucking years.
So 7 years of your life.
Is that right? There's no way.
These are like, yeah, that's crazy.
Sit with that. I mean, my calculations don't think they're perfect, but I mean, come on. Like, this is insane. Like, that's why. Okay. Anyways, keep going.
Yeah.
I digress.
Yeah. No, you're in good company for that. Okay. So heavy bleeding, what you really need to know is normal blood loss, 60 to 80 milliliters for your entire cycle.
Can you like,
so I'm going to break it down even more.
I'm like, come on. I don't put like my blood in like a milliliter. I'm like, hold on. Let me measure this.
Okay. So the average regular tampon, heavy tampon, holds 10 milliliters of blood saturated. The same with a regular pad. A menstrual cup or a menstrual disc will hold anywhere from 30 to 50 milliliters of blood. So if you're somebody and you're using a menstrual cup and you're filling it up twice for your whole cycle, like you're there. And I get, so the main thing too is like, obviously if your tampon or your pad's not fully saturated, like you're still going to change them every couple of hours. Like that's fine. So sometimes I have to tell people like, just if you had to, it takes a little bit of imagination if you're using those, because obviously we don't want you to keep your tampon in for like 10 hours if it's not saturated, because that's not great either.
No.
So you will have to get a little bit, creative with trying to determine like, is that about half saturated, a quarter, kind of what does that blood loss look like? But most people are actually saturating a tampon or a pad every hour to 2. I mean,
totally.
Easy.
Well, what size tampon are you talking about, right? Because there are
I'm
like a
talking about
super.
your regular.
Okay, so a regular, so they should be going through about up to 9,
No, up to 8.
up to
8 would be
8.
your top
Okay.
level. 6
Yeah.
to 8, because you don't
Okay, and
want to
that's fully soaked. That's not
fully
like you
soaked. Yeah.
pee, because when you pee and you have a tampon in, it gets all wet and soggy and
Yeah. So you
ugh.
might take it out and change it. Yeah.
This is why I switched to cups, by the way. If anybody is not,
I love menstrual cups. It's like a
oh my
life
gosh.
changer.
Like I want everyone to know about menstrual cups. You have one and they boil it at the end of your cycle. You dump it out when you're in the shower. I mean, and you dump it out every 12 hours. It's incredible.
Yeah.
I have an episode on this earlier. I need to look at which episode it is, but if people want to listen to how to find the right period product, I have an episode earlier in this and I can tag that in here. But
Yeah,
anyways,
that's awesome. But it makes it
yeah.
easier too for then determining how much blood loss, because you really can see like, ooh, is that menstrual cup all the way full? Then, and I know this thing is holding 50 milliliters, and maybe that was on your first day, and then on your second day, it's almost full again. You're at 100. You're already now into the heavy bleeding category.
Mm-hmm. But that's what everybody thinks is normal.
Right? Yeah. And I've talked to
Mm-hmm.
people too. They're like, "Oh yeah, I have to change my menstrual cup more than 12 hours. Like I have to do it like midday because I've gotten that question too. They're like, what do you do like in the middle of the day if you have to do it from like a rinsing and sanitary?" Like I was like, "But I don't.
Mm-hmm.
Morning and evening because I don't thankfully fit into the heavy bleeding category for that. But I mean, that definitely is an eye opener for some people. Um,
Oh yeah. I mean, like even just in our pelvic floor training, like they don't talk a lot about these details either. And
no,
so it's it's crazy how much we are just the lack of information about it. I mean, estrogen dominance is something that I have suffered with for a very, very long time. And I'm in the process of normalizing that. And
yeah,
thanks to you, you're the one that brought it to my attention. And I was like, oh, because I kept getting like acne, severe, painful periods. I mean, crushing mood swings. Like just like a couple of days before my cycle, I'd be like, why do I'd get some dark ass thoughts. And I was
yeah,
like, something is off. I don't feel like myself, but I don't know what's happening. And this isn't normal. And, I'm a pelvic floor physical therapist. So I know like it's something to do with my cycle. And then when I got my cycle, they were like blood work, they were like, oh, that's fine. You're normal. I'm like, how the fuck is this normal? Like it's not.
yeah.
So anyways, so yeah, if you want to kind of, so okay, so the irregular or the heavy
Yeah,
bleeding.
so heavy bleeding, clots with your cycle. And a few like really like tiny, tiny clots are fine, but if it's anything a quarter or larger, that's what I'm talking about with that tissue. Endometriosis is a estrogen dominant because again, like we talked about back in the follicular phase, the role of estrogen is to build up our endometrial lining and our endometrial tissue. And so it doesn't matter where in your body that endometrial tissue is, but if we throw some estrogen in the mix, it's gonna make it grow. And so that's going to continue to feed that endometriosis.
Let me
Food
kind of
cravings. Oh,
let's
sorry.
kind of because I don't think enough people actually know what endometriosis is. And so briefly, which is like I know it's hard to say because we have an hour. Can you describe it a little bit just so people can be like, is that me? Is it not?
Yeah. So endometriosis is, by like true definition, is the internal lining of our uterus. So that tissue, imagine that it got out of our uterus and it can be anywhere
It's
in our
attached to
body.
anywhere.
It
Yeah.
could be anywhere. And so really it's just the presence of that endometrial tissue outside of where it should be in the uterus. And so oftentimes like your hallmark signs, which there can definitely be some atypical signs as well. And I've definitely seen it, and I'm sure you have in patients too. But you're going to have cyclical pain, um, intense cramps. So these are the folks that, you're the first day of your cycle, you can't go to work, you're doubled over in bed, you can't function. Pain with sex is another huge kind of hallmark of endometriosis. Um, you can have lots of bowel issues, again, that tend to be more cyclical as well. And so once we really start to see kind of this pain and inflammation that has truly a more cyclical pattern to it, and if, periods are not great and sex isn't great, like to me, those folks, I'm sending, like, you need to get assessed for endometriosis.
Well, the thing that sucks though about endometriosis is the gold standard is still the laparoscopy.
Yeah, I have lots of thoughts on that. And really, if we're going to think about doing any type of surgery, it needs to always be done by an excision specialist, which they're not everywhere. And, we shouldn't just be going in and doing, a local laparoscopic surgery trying to get your endo out of your uterus or around your fallopian tubes, around your ovary, just like in your pelvic cavity. Like
Well,
that to me is such a disservice and can promote its growth and spread throughout the rest of your body.
well,
It's just
it
so,
doesn't address why. Like, okay, you
no.
remove it, but it's still there. Like, for instance, like I have endometriosis and it's something I manage through understanding what we're going to be talking
Yeah.
about. And when I don't have it managed, which like this last month, I've been under a lot of stress. My cortisol is spiked. And then naturally it's the holidays. So I didn't eat as healthy. I haven't been meditating as much or exercising. So I just like went off the rails. So like my period is not ideal right now, but I know how to get back kind of onto it. And so that's the empowering part. But it's still insane to me that that is something we just jump to because first of all, then it promotes more scar tissue on top of it. And the tissue is actually scarring onto other organs too. That can also attach to the rectum. That's why you can have bowel issues during your cycle. But we won't have to dive so deep into that, but just so people can be a bit more aware. So go ahead, keep going with the other symptoms.
Okay. Food cravings.
Yes.
Hello. Yep. We mentioned that one. Hormonal and premenstrual headaches. I definitely see this one a lot too. Those like cyclical headaches. Fibrocystic breasts. So not even just tender, but if you feel like kind of lumpy, for lack of a better term, or cystic breasts, that definitely is a sign of excess estrogen. Fibroids, because again, that's that tissue growth. And so estrogen loves to help tissue grow. And so that estrogen is just kind of feeding that fibroid. Irregular bleeding, short cycles. So not, we really do want a 4 to 5 day cycle. Like a 2-day cycle is not something to be like, woohoo, I have a short cycle, or, not something to be super excited about. It's telling us that something's not
off.
quite right with our body, and depression. It's a huge one.
Definitely have had that. Oh my gosh. Yeah. If you're like a few days before your period and you're like, man, having some dark thoughts or just super anxious and you don't feel like yourself, you're not crazy. Just know, please know that.
Yeah, you're not.
You can feel sometimes it's physiological. Like it's just, you can feel outside of yourself. And the amount of times I've been gaslit about this has been insane. That's why I'm so obsessed with just talking about this stuff because if you don't know this, it can be really disempowering and really scary.
Yeah, it can be. And I'm going to say too, like with depression, because I've been doing more research in the perimenopausal population, because that is, and we'll kind of get into this maybe a little bit later, but perimenopause is one of those times that we start to see estrogen dominance. And we see that there can be a sharp increase in depression. And
Oh,
it's
yeah.
no coincidence.
Yeah, totally. Well, it's interesting though, because I think when you think of perimenopause, right? People think their estrogen's lowering. We think so much about estrogen, estrogen, estrogen. And I've seen so many people put on estrogen right away when it almost makes their symptoms worse.
Because it all goes back to what I was first saying. It's about the ratios. So
Mhm.
while yes, estrogen may be dropping, but your progesterone is dropping even faster. And so that ratio is now way out of whack. And
Yeah.
that's what we need to really address. And so honestly, progesterone supplementation is going to be really helpful.
I was listening to, so I'm in that global pelvic health group that Tracy Scher runs.
Hmm.
And one of the ladies on there, she's a surgeon that specializes in endometriosis. And one of the things she was saying was just talking about how, like, or at least I'm pretty sure it was on this. She was saying like the first line of defense in every other country is to go on progesterone, but for some reason in the United States, people are put on estrogen.
I know. I had a patient asking me that the other day about how she had endometriosis and they put in a IUD that was estrogen driven and she was questioning it. And I was like,
Good for her.
why?
Good for
Yeah,
her for
yeah. And I was
knowing.
like, yeah,
Not
that
like
actually
shaming
doesn't
people who
make
don't
sense
know.
because the estrogen is what's feeding that endometrial tissue. So really, you would want to ask some questions around maybe a progesterone if you want to be on a hormonal birth control. Progesterone only might be the best route for you and not a IUD that is estrogen driven.
Yeah. So if you're listening to this and all these symptoms sound like you, look at your birth control. What are you on? Is it
Yep.
mainly estrogen? Are you on progesterone? Some people are on progesterone, but I can
Yep.
almost guarantee you most people, from what I've seen, they're on some form of estrogen and then they're just stuck. They're just on it until whenever, indefinitely. And
And it's
they
just
don't know
masking
why.
symptoms.
Yeah.
Yeah.
And they don't know why. I think we'll dive here in a second into like, yes, we can do the progesterone supplementation. But like just for people to know, like, and have an idea, can you explain? I was so freaking fascinated when we talked about the breaking down and producing of progesterone. So why this happens and explaining a little bit about why does the estrogen or the progesterone lower, what causes that, because I'm all about like what can people take away from this like right
Yep.
now that is and that they can take away right now. And so one of the things we talked about was like how cortisol goes down that same pathway. So
Yep.
can you blow people's minds right now on this, please?
I could try. Okay. So you might have to pull me out of the weeds a little bit here. Um,
Just maybe don't go through all the cascade. Just kind of like
You
start with.
already like can see, yeah. You're like reading my mind.
I see
I
you.
will.
I'm like,
I will. You see where I'm going. Okay,
I know,
but I
like,
am going to start with cortisol, or not cortisol. Cholesterol is
yes,
the start of everything because I also think that that's important because I've had a
massively important.
lot of patients. Also probably more in the menopause and some on the male end of things that their physicians want to be really, really aggressive at getting their cholesterol like super, super low. But we need to know that we need cholesterol to make our hormones. And so if we are on a low fat diet or we're scared that our cholesterol is going to be too high, that can definitely be impacting your body's ability to actually create hormones. So don't
This,
be afraid of fat is my number
this,
one kind of starting point.
this fact, I feel like we need a moment of silence here for the women in the 90s that had to
Right?
go
Like
into the no fat diets.
the worst thing we could have done for our hormonal
Oh,
health.
and add cardio on top of it, all that. Oh
Yep.
my God, these poor
Hit
women.
high intensity. Like, yeah, we're we're screwed.
Which
essentially.
those things aren't necessarily bad. HIIT is not necessarily bad. It's just that the amount
At
of
a certain point, yes.
the amount of
Compare it with the low
intensity.
fat and the other stress in life. Okay, so
Yeah.
anyways, we need cholesterol
Starts
to make
starts with
hormones. That's our
cortisol. Or
big
sorry,
umbrella.
starts
Yes.
with cholesterol.
Starts
Like
with
messing.
cholesterol. Okay.
Okay.
And then it goes down, kind of goes down this pathway. And then really our body has to decide if it's going to make progesterone or if it's going to make cortisol. So cortisol is our stress hormone. So when we're like really like fight or flight or in the thick of it, and there's so many symptoms that we could talk about related to cortisol, elevated cortisol levels. But our body then chooses in times of stress to make more cortisol and stop making progesterone. And our bodies are super smart, right? So the reason that this also occurs is that our most of our bodies were created with fertility in mind. So, regardless of if you want to have children or you don't want to have children, this is why our actual fertility status is a good indicator of our overall health. So, if our body is wanting to be fertile and be able to get pregnant, then that's why we make progesterone. But if our stress level is so high, that's not conducive to creating a life and maintaining a healthy pregnancy. So that's why, as a protective factor, our body just shuts down that progesterone pathway. So now we've got increased cortisol because of the stress in our life. Progesterone is dwindling. And so we see this also too in something called hypothalamic amenorrhea. And so we see cycling women that are losing their periods or having anovulatory cycles. And it can be due to, it's a triad, it can be due to any one of the three things or a combination thereof. High levels of stress, which we talked about. So our body shuts off that progesterone pathway. Under eating, and over exercising.
Everything we've been freaking taught to do.
And we're losing our cycles, and you'll go to your physician and they want to just put you on birth control, which is not
Estrogen.
a solution to any of our problems. It's just like, hey, here's a really bad Band-Aid on the situation instead of trying to dig deeper. Or these folks will get labeled with PCOS. They don't have PCOS. They have hypothalamic amenorrhea. Their system is shut down because it's under such stress that it's not going to ovulate.
So they're losing their periods. But
yes.
So what's insane to me, and this is something that like, I know there are people that truly struggle with infertility. I have done IVF in the past. I do not have children, but I did because I am a carrier for a genetic illness. So in that case, it doesn't matter my hormones. Like it's just whatever, right? But we have such an insane amount of women unable to get pregnant, and we are not talking about this.
Nope.
It is insane. So now let's think about our generation, right? So we're like, I'm 38. How old are you?
Yeah, about that.
About that.
Same generation. Yeah, we're the
same generation. So our generation was just like put on birth control. I never was able to tolerate it. In retrospect, it's because it was estrogen dominant, and I went psycho on it. Not like psycho, just cranky, whatever. So let's play this out, right? So our generation, okay, we grow up. We are the generation of Britney Spears being called fat when she gained maybe 5 pounds.
Yep.
Okay. We are the
skinny.
We are the low fat, high cardio. Okay. Estrogen birth control. We are also the first main generate I guess Gen Xers would be, but like our population of women are more in the workforce.
Yep.
They're taking home, they're taking on the household duties as well.
Yep.
Okay. Now taking on bias against women in the workplace. Okay. That's not even adding on any other stressors. And we're
it's not even considering if they have a family, if they have kids.
Oh.
Because then they're also the primary caregiver. If kids are sick, who's staying home, mom or dad, in
Exactly.
our generation,
Yeah.
mainly.
Yeah. In heterosexual relationships. But yes,
Yes.
exactly.
Yes.
And so it's like, and then we're gaslighting them on top of it. And then we're telling them they're fat and they need to lose weight and just it's anxiety. Just go on an SSRI. So now we're going on an SSRI when it's not even it's a hormonal issue.
Well,
And
and
so
SSRIs will impact your hormones.
oh yeah, I was on Lexapro and I gained 35 pounds.
It changes your body's
It
creation of
made
progesterone and estrogen. And so if you come off of them, then there's, yeah, we have, your
you
body
and I
has
had that
to,
conversation because I was like,
yeah,
me getting off my SSRIs has been worse than chemotherapy. Let me say that again. It
yeah,
has been insanely difficult. And that's why I'm so thankful you and I talked because I was like, I don't know what's going on. Like, this is insane. But I was getting gaslit again by being like, just half your Lexapro and get off over time. Like, I've been on this shit for 20 years. Okay. My whole body has gotten used to this.
yeah,
And so it's this cascade. It's,
yep.
oh my gosh. And when I see it in the clinic, I see it all day, every day, all day, every day. And it's just the only thing we can do is just keep talking about, keep getting the word out,
Yep. Yep.
keep
Exactly.
educating. Um, and so now let's talk about, so people may not know what insulin resistance is, but this is one of the main reasons if you have like, if you feel like you can't lose weight, not saying if you want to lose weight, it's more of, I think of weight gain as a symptom. I don't think it as like somebody needs to look a certain way. I think it's our body giving us a message.
Yeah.
And so, um, with insulin resistance, so basically, how does this estrogen dominance affect insulin resistance? Actually, before you answer that question, can you explain what insulin resistance is? Brief, or do you want me to do it?
No, we can.
Okay.
You can chime in or yeah.
Because this is
So
super important to it all, like
yes.
incredibly important.
So when we eat, our body, as it's digesting our food, it will turn some of it into glucose or sugar, to be very like simplistic about it. And so we've got sugar that's in our bloodstream and it needs to get inside of our cell. And so in order to do that, it attaches onto insulin and insulin helps to bring it into the cell and for our cells to use that as energy. And so what happens over time is that our cells become resistant to that insulin, and we can't get that sugar or that glucose into the cell where we need to utilize it. So now it's just circulating in our bloodstream. And so that's why if you go and get a blood test and they test your glucose level, that's what it's really showing you is how much glucose or how much of that is circulating in your bloodstream right now. And there's definitely certain levels of that we want. And so when we see insulin resistance, that is kind of the beginning of a metabolic dysfunction, which is kind of our overarching title.
Like
And it
yeah,
just
it like
turns
slows
us
your
down this
metabolism.
it's a very vicious cycle. Like metabolic dysfunction is responsible for so much not great stuff happening in our bodies, um, including weight gain. And then really what happens is when we gain weight and fat, our fat actually helps to create estrogen. So now that's kind of how they're starting to correlate together. So now we have some increased fat and we're increasing our estrogen rate, which then doesn't help our
Increases the
metabolic,
dominance.
our insulin resistance, and then increases our estrogen dominance. And now we're just in this like loop cycling in the wrong direction.
So if, people are listening and you're feeling overwhelmed, we're going to summarize it in a little bit of breaking this down of like what to do. You can listen to this episode a few times if you need to. It is incredibly important to maybe listen to this episode a few times just for you to understand your body, because once I found this out, it changed my life. It changed my relationship to anxiety. It changed my relationship to depression. Everything started to make sense because my physical symptoms were correlated to something that I had never been told about. And so what's interesting though about insulin resistance though is that most physicians are unaware of this. So you can even get your A1C, which is A1C will measure like your blood sugar over the last 3 months, and it can look still somewhat normal, maybe even pre-diabetic. So that doesn't even necessarily show if you have insulin resistance.
Nope.
So sometimes if you can see, I've seen it where they'll do like, you can just even see like, oh gosh, what would you say the best way to maybe look at maybe your fasting glucose. So your fasting blood sugar, so your glucose, looking at that. Oh, it did a thumbs up when I did that.
Hey, nice. Yeah, I always recommend people do all labs I like fasting because it just kind of evens the playing field. Because like if we're eating something different or drinking something different, it can definitely impact what's going on in our system from even an inflammation perspective, and it can change what our lab values are showing. So number one, I always tell people to fast. That's usually for at least eight hours. So glucose, a hemoglobin A1C, and then a fasting insulin. So those are the three things that I'm really looking at when I'm assessing anybody's labs. And really for A1C, the traditional medical cutoff is 5.7. They'll start to say you're pre-diabetic. And so like you could get, 5.6 and be like, Mary, you're doing great. Well, you're like 0.1 away from pre-diabetic. Like you're going down the wrong direction. I personally like your A1C to be 5 or under. And so if I'm noticing that someone's A1C is like 5.3, I'm starting to have the conversation on what do we need to do to get everything back on track, because we don't want you even to get close to a 5.7. Like we want to stop this metabolic disease from progressing, and we want to come back to where you're going to feel more optimal. And so there's a lot of things that we can do from a diet and lifestyle perspective in order to help to get that back under control.
So we're going to jump into all of that because that's the biggest takeaway for people to take action. So in summary, we're going to try to digest this all. And if you need to correct me, please do this. Okay. So first, if you are experiencing any of the symptoms that we talked about, abnormal periods, painful periods, tender breasts, lumpy breast, pretty much any freaking symptom that we've taught is normal around your cycle.
It's not.
It's not. Okay. This is a sign that your estrogen is likely more dominant in relation to your progesterone. So those are just the two hormones you just have to remember. Okay. And so when that happens, that offsets this whole cascade of symptoms, which you can have those symptoms. And so that's a big sign that you may have it, but you can get your labs done day 3 for estrogen and day 18 for progesterone. And what did you say for LH and FSH?
That's day 3.
Day 3 too. Yeah. Okay. So basically all of them on day 3. And then
except for
progesterone, which is day 18. Would you say 18 to 21?
Yeah. Okay. Depending on if you're tracking your cycle, then you kind of know. Otherwise, day 21 is pretty standard.
Okay. And then if you are on birth control or you have irregular periods, so it's hard for you to know, she's recommending the Dutch test, which is a urine test. Where can they get that?
So Dutch has the website, or they can work with a provider.
They can go directly to the website and do it?
I think they can go to the website and find a provider that's close to them.
Okay, perfect. So that's a great takeaway for them to see. And so one of the major reasons why progesterone is low is because of a high cortisol. And high cortisol is when we get really, really stressed, our body releases cortisol, which basically releases a bunch of blood sugar into our bloodstream to help us run from a bear. It doesn't know that we're stressed out about all the bullshit happening in life. It just knows we're running from a bear. So if you stay in that, and it's not just going into fight or flight, it's the fact that we don't come out of it. And we don't know how to come out of it because our society does not value the things that bring us out of fight or flight, right? We're in the US, just for people that are listening.
Yeah.
And so that can be a major factor. And then when that happens, your estrogen's higher, then when you develop the insulin resistance, you have more fat on your body, which then increases your estrogen. So they're not directly related per se, but they affect each other, correct?
Yep, correct.
Okay. So if you're insulin resistant, you're going to likely have more fat. And when you have more fat, that's going to produce more estrogen. So now add on, if you're estrogen dominant and we're in this high stress state, your body is producing that stress hormone instead of progesterone.
Mm-hmm.
So
now you're even more estrogen dominant than you were to start with.
Yes. And so then with that, if you want to know if you're insulin resistance, you would look at your A1C, your fasting glucose, and your fasting insulin. I will fully admit my A1C is not that, although it's been kind of wild since chemo. So I've been working on regulating it. But I think in the last few months working on my estrogen dominance, I'm going to see it significantly change. You'll also see too with insulin resistance, high blood pressure, high cholesterol, because that all happened to me too. And I was like, what is happening? This is insane. So why does that thumb keep popping up?
I don't know.
Yeah. All right. What are some lifestyle changes people can implement right now? So they can ask their doctor and talk to them about progesterone supplementation.
Yeah. Or you could do a topical progesterone cream as an option. And I tell people if you're cycling that you want to use that appropriately in your cycle. So in that luteal phase, so post-ovulation, prior to starting your cycle again, because that's when we want that progesterone to be elevated. We didn't touch on it a ton, but we also want to look at, so really there's 3 phases of estrogen detoxification. So this could be another reason why we have elevated estrogen levels, because one of the 3 phases of detox is not going appropriately. So the first 2 phases take place in your liver, and the third phase is actually your gut health, and so your ability to have regular bowel movements. So if we're constipated, that gives our body more time to reabsorb some of the estrogen we're trying to excrete. Okay, if we have poor what's called phase 2 detoxification of our estrogen, that again can cause issues. So that's kind of when we talk about methylation. So people have heard of the MTHFR, that kind of comes into here. And then there's also phase 1 of detoxification in our liver. So what we would want to do from a diet and lifestyle is to help to optimize those detoxification pathways. So cruciferous vegetables are fantastic to support especially phase 1 and phase 3. It's going to help keep everything moving. So cauliflower, broccoli, asparagus.
I was just going to say what she's saying is basically, we have excess estrogen. So estrogen dominance we want to help get the body to process and excrete the extra estrogen. And that's what she's describing here.
Thank you. Yeah. So to do that, and we would just want to support all of those phases. So definitely broccoli, asparagus, cauliflower, things that
Tutti
are
vegetables.
Yes. I tell
Toots.
people really aim for, I think we were taught, you can tell me if you were taught differently, but more in the pelvic health world, 25 grams of fiber a day. actually it needs to be like closer to 40 to 45 grams of fiber a day.
But I will tell people, don't jump into eating like a crap ton of broccoli because you will be gassy and bloated. You got to ease your body into it because if you have a partner, they're going to be so annoyed at you farting around the house. Let's just be honest.
Yeah. And not all fibers created equal. So this is why I personally love chia seeds. And I like tell people to, chia seeds are so fantastic because it just really
They're
helps to
good.
like soften your stool. They're like anywhere from 10 to 15 grams of fiber per serving. And I tell people just make a smoothie, like, because berries have good phytonutrients. They're a good source of fiber. And so load up some berries, put some chia seeds in there. Like you have like a fiber packed smoothie. You're supporting your liver. You're helping to excrete your estrogen.
I like doing the chia pudding where basically I want to say it's like half chia seeds or maybe a little less. And then the rest is some form of milk. And then I put a little honey in it and it's like pudding the next day.
Yeah. I've heard people too like add like some cocoa powder to it and it's like a
And you
chocolate
can add
pudding. I haven't
berries
tried
to
it.
that.
Yep.
Yeah.
So many ways, but really like number one takeaway, get more fiber into your diet. Like that will automatically help to
Flush
decrease
out.
that estrogen in your system. The other kind of surrounding the insulin resistance piece too is never eat a carb by itself. Always pair it
No
with a
naked
protein.
carbs.
No
Yeah.
naked carbs. Um, so if you're going to eat an apple, have a little piece of cheese or a little bit of almond butter or something like that with it. Like don't just have your carb by itself. And then the other piece is you want to try to walk for 15 minutes after each meal because that will automatically help your blood sugar, that glucose, get into the cell without using as much insulin. And I've had people ask, like, does it matter what time of day I walk? If I walk for 30 minutes, like in the morning, is that fine? I said, no, it has to be very time specific. And it doesn't necessarily have to be walking, but like some type of movement for 15 minutes after you eat is going to help if you have insulin resistance to help to kind of bypass that system.
But it can still like, I mean, because if people are listening, like I can't walk at 15 minutes after every meal, like still walking,
Yes,
like
it's
some
still
form of
good.
still good, optimally after a meal, but if not, walking daily
Yes,
would make a big difference too.
yes. Or even if you can't commit to 15 minutes after a meal, like whatever few minutes you can, like something is going to be better than nothing from a timing perspective too. Or potentially like make sure you're walking maybe after your most carb heavy meal is going to help as opposed to if you had a meal that was mainly like protein and fat, you know, we're not getting as much blood sugar spike from that. So you definitely play around with it, but the overall kind of sentiment to that is if you can move after you eat, that's going to be helpful.
Perfect.
So,
well, and then, to kind of add on to that too, is like, this is why so many people are talking about like strength training. So when you're strength training and you're building up that muscle, your muscle absorbs that glucose for you.
Yep.
So that's why a lot of times when you're in perimenopause and you're gaining weight and you're not sure why, typically it's because you're probably doing a lot more cardio. You're probably not eating enough. And so those two things, if you're doing intense cardio, your cortisol spiking, and then you're not recovering because you're not eating enough. And then maybe you're not sleeping. And so it's kind of wild how almost slowing down and walking and strength training can be really incredible. But if you still like to run and stuff, that's great. But it just depends on how you feel, right? If you don't feel good, like when I would do intense hits, I was like, I was like, why did I do this? This doesn't feel good. And
well, the other piece to that too is, so we talked about like how your cortisol is elevated. Over time, our system can only have an elevated level of cortisol for so long. And then what we end up seeing is the reverse. Then we end up in this low cortisol because we are so stinking fatigued and we've burnt our system. We've burnt out our system when our cortisol bottoms out. And when people are at that phase, I want them moving, for stress relief, but I don't really want their heart rate much above 90 because your system is so
It's
kaput.
taxed.
It's so
It's already
taxed.
taxed.
And so we need movement and gentle movement, but that is definitely not the time and place to be pushing it by any stretch of the imagination. We need to help our body recover and heal. So, that's why too, if you're listening and, you, like Mary said, like you feel like crap after a HIIT workout and so depleted, like that might just not be the right thing at this point in time for you.
Or you
That
just
doesn't
don't
mean
push.
forever.
Well, I mean, I like HIIT workouts. I just don't do them intensely. I just chill
Yeah.
out a little bit. Like I just like
Yeah.
don't go all out and it feels good. So technically it's just more of a strength training thing.
Yeah.
Um, so I know you have to go soon. So
Yeah. I wanted my last like big piece
yeah.
too for what is increasing estrogen, especially in our like this day and age in our society, is endocrine disruptors, which we didn't really even talk about, but this is
We
my
have to
other.
do we're gonna have to do a whole nother episode together because there's so much to talk about.
But essentially, an endocrine disruptor is something, a substance not produced in our body that comes in and will attach onto our cells and will mimic estrogen. So things that can be endocrine disruptors they can be in our clothing, they can be in our personal care products, our shampoos, our laundry detergents. There's kind of this whole long list, but essentially many things that are around us this day and age are an endocrine disruptor, and that also can increase the estrogen dominance in our system. And so that's another place to kind of start to look for people, and something that they can do from a lifestyle perspective is just start to make a little bit better of a choice in the products
Products.
that they're using or the clothing. And I tell people too, like you could get like way out of control with this. And
I went down I went down a crazy path with this and it like stressed me out more. So
exactly.
I think there has to be a balance because I saw some guy the other day on Instagram saying, don't touch receipts. I was like, I'm sorry. If I'm stressing about touching receipts, just I'm done. Like I can't, I have so much more to stress out about that. There's a balance here, but I think it's super
Yeah.
important to be aware of like, there's so many dyes like in our detergent and
Yes, like that's an easy thing. And I tell people
yeah,
like switch it out like when you're done with what you have. Like
yeah.
don't necessarily like throw away everything in your house, but like, hey, when my deodorant's gone, like I'm gonna replace it with this instead. And just like slowly making smarter choices for your health is is better because again, like if you make a small change, like you've seen this in the PT world, like you can't ask patients to completely upend their life. Like it's going to be more stressful. They're going to fail at it. Like pick
It's going to
one
cause more.
small change and do one small thing at a time. Be successful with it. Like that's going to be so much better for your health for so many reasons, honestly.
Well, yeah, I went down a path where I just threw everything out and it was like I just went all out. And so I would just say like when you're just being aware of it, there's a balance between obsessing about it and a balance of actually like all of my stuff is like clear. I try to be aware of like my facial products that I put on. Like if you go to like Ulta, Sephora, a lot of them are saying clean beauty products now. I'm looking up, it's like EWG Skin Deep Cosmetics Database. There's a lot of places and apps that you can scan and look like, because they're all going to have some form of a little bit of toxicity, but just knowing how much you're putting on your body and being aware of that
Yeah.
is going to be super important. I will be fully transparent. I have not switched from an anti perspirant. Wait, which is the one with I can't. I've tried no aluminum, and man, I will have no friends.
I tried. I had given up on this search because I had tried like every single one, and some of them are like they make you smell worse,
I
right? Like
know, and
it's
so like
not
what?
like it's not. And so I had a friend. She was like, Michelle, I swear this one is good. And I was like, it took me a while. It took me like months before I finally ordered it because I was like
Which
so
one do you like?
So Primally Pure is the
Oh.
only deodorant that I have found that actually works and doesn't make you smell like it doesn't make you smell bad. Like that is literally the only one that I
Yeah.
have ever tried after years and years and years, and I had given up like many times, and I'm like, I'm just going to use the stinking aluminum, and
I've literally resorted to, okay, am I going to hate the way I smell all day? Is that going to stress me out more? You got to weigh out,
you do.
right? And so I go through phases, but it's just being aware of all of it. So the other thing, was there another one you wanted to add?
Nope, that's the only deodorant I will.
Oh, no, sorry. No. Any
enjoy.
other, because the other lifestyle thing that I find, and is really the main reason I started this podcast, is to be authentic and real and all these things, is thinking and working through a lot of inner shit. Like, ultimately, you can do so many things, but if your inner narrative is negative and you're processing a lot of if you're dealing with a lot of unprocessed trauma, right? And if you're in environments that keep you small and are toxic, I say this because I literally did so many things, right? And that's when I got cancer. Not saying people are going to get cancer, but I talk about it because it's like I was like the epitome of like in good health from like Western standards. And if there's one thing to change, and all of this seems really overwhelming, just start noticing your inner thoughts and noticing those stress levels, noticing the things that are not bringing you joy or happiness. Like, what bullshit are you dealing with in your life, right? I'd say even just start there. And then as you start kind of going with that, then you can start looking at products, and then you can start looking at these other things. You want to do it that feels good for you and it's not stressful.
Yes.
Because then it's almost counterbalancing it.
It 100% is counterbalancing it.
Yeah. And so I almost think like for what's working for me is almost like the progesterone supplementation and stress management, and then exercise, and then just kind of every morning daily meditation, even if it's just 5 or 10 minutes. I find that when I'm just running out the door, the rest of the day is just shot. And so kind of getting into something that calms and helps support your nervous system, and then start looking at your diet, and then start looking at all these different things. Because like we were saying, just don't stress yourself out doing it. Just start noticing there's power in the patterns. That's what I say.
100% agree.
So, well, thank you so much. I will put your information below. Do you have an Instagram or anything you want people to follow you at?
Yeah, so I'm at Weeks Wellness is my Instagram handle. And actually in our bio, we have a link to a hormone symptom quiz.
Ooh.
So you can go on there. It's a free quiz. You can take it. It looks at more than just estrogen. But if you have any questions on if some of the symptoms that you're having are related to hormones and you're not quite sure if you need further testing or not, that's going to be really helpful to you. So
perfect. And are people able to work with you guys virtually?
Yes, they are.
Oh, sweet. Okay. So good. If you guys, that would be helpful for them to, get some information on understanding their hormone balancing and work with your staff. And I know you're probably super busy, so maybe you directly or
me
not?
Too. Yeah. No, this is like my love for pelvic health. This kind of like hormone niches.
Oh my gosh, you have been such
a
wealth of knowledge. So, all right, thank you, and we will put all your information below.
Okay.
You've been listening to TMI Talk with your host, Dr. Mary Grimberg. Make sure to subscribe wherever you get your podcasts. To learn more about Dr. Mary, head on over to drmarygrimberg.com. And make sure to follow Dr. Mary at Dr. Mary PT on all social channels. To learn more about Dr. Mary's integrative practice for pain relief in Austin, Texas, head on over to resilient-rx.com. Thanks for listening.